Hello, Nivi. Thanks for joining. I'm really sorry. I've been in the wrong room. It's a bit embarrassing, actually. So there's quite a few people registered. Thank you for joining. I'll just set up my sharing of the presentation. I'm so sorry to keep you waiting. I have been in a different Zoom room. Could you please put a note in the chat if you can see, or pop your microphone on to let me know if you can see the first slide with a green background? I think you can. So I'm going to check that we're recording because thank you, Nivi, for letting me know that. Welcome and great to have you here. I'll get started now. And again, apologies for keeping you waiting. And hopefully other people will join as we go. And I am recording the meeting and I'm happy to take questions at any time, but if you'd prefer that not to be on the recording, wait till the end and I'll let you know when I turn off the recording, and then I can answer your questions, and I'll share this recording with other people who weren't able to make it. But a few people joining now, which is wonderful to see. Okay, so let's get started. So, of course, it's interview season is definitely happening at the moment. I am getting a lot of inquiries from people and working with a lot of people across Australia to start really taking on the serious preparation for their upcoming interviews. And I'm running a series of 3 webinars over the next 3 weeks, Thursday evenings, and this is the first one, how to structure your interview responses to get sort of maximum effect and score well in your interviews. This is something that a lot of people talk to me about, that they feel that they lose their way in interviews and that they lack structure. So one thing I want to say from the outset, though, is these structures are recommended as a guide for you to follow, to give you a great starting point and key points throughout your response to make sure that you get back on track after providing information. But I really want to stress that you really want to develop your interview skills in a way that you're not coming across as being overly rehearsed, or sort of that your answers are scripted. And of course, the most important thing is to ensure that you're answering a question and making, checking that you've understood the question and not sort of understood part of it and then missed the second part of it, or you've honed in on something within that question that sends you off on a different path and strays away from the points that they're actually wanting you to convey. So we're going to cover a bit of ground here, and I said that I would send out a resource for everyone after this, which I will. And it's a document about 4 pages that is a great summary of each of these structures. So I hope that you find that helpful, and you're always welcome to ask me any questions anytime, outside of the webinar, I mean. So essentially that's the homepage for my website. You can always get in touch, have a chat, even if it's a 15-minute chat to help you out. I've had one this evening with a paediatric fellow, and she wanted a couple of pointers, and that's it. She's off on her way, and other people will, of course, undertake interview training with me. But let's get into it. So as I mentioned, there's quite a lot to get through today. So first of all, why really good candidates can still perform poorly in interviews. And I meet a lot of people who say that they've feel that that applies to them because of their response to or reaction to the interview situation. But I think what often lies at the bottom of that is really a lack of preparation. We'll talk about the differences between what's an average and what's a sort of top tier answer. You want to get into that top group of candidates that are being shortlisted for the position. We'll definitely talk about structuring answers and structuring them under pressure, and the other points on here that I won't repeat. Let you have a read while I'm taking a sip of water. So let's get through it, and including some practical examples and what the assessors are looking for. So first of all, why people struggle, it's not because of their lack of clinical knowledge or experience in medicine, because by virtue of being invited to an interview, it signals that you're qualified to apply for that role, you're eligible, and they think that on paper, at least, you're an excellent candidate. But these are the reasons why people, as I mentioned, lack structure. They start to ramble when the pressure's on. That jumping to conclusions relates to the comment I made a moment ago about thinking that the question is asking one thing when it actually is meaning something else. And patient safety issues can't be overlooked. So that's what essentially one of the key assessment pieces that they're looking at is how you convey your sense of being a safe clinician and taking care of the patients when they're not available, when your bosses aren't there. They don't explain their reasoning. So people will say things that they've done and talk a lot about, oh, here's this story and these were the things that they've done. But the better candidates summarize those points more succinctly and talk about why they did certain things. That demonstrates their insights and the reasoning into making certain decisions. As I mentioned too, people can start to sound a bit overly rehearsed and generic, and they fail to reflect. So actually last night I was working with someone that's applying for one of the surgical set programs and subspecialty, and she was saying how she's got quite a refreshing approach, really. She doesn't come across as being overly rehearsed or generic, and she's noted that in her cohort, her style during practice with some of her peers has been quite different to the others. And I think it's really interesting because that's one way of sort of standing apart from the rest of the other people is doing things your way. And actually, it's just so important to be yourself and show your authentic self. You can't don't overly try to impress people. Be yourself, provide great, relevant information and strong responses that are relevant to the role, and position yourself as to why you're the best candidate for that. So I'm sort of jumping the gun, so we're getting to that. So what they're looking for. And one of the comments that she made, one of her consultants had said to her, a tip for the interview was try and sound almost a little bit conversational. And I'm careful about saying that because it is a very formal interview setting. But if you can develop a natural delivery style, that actually goes a long way to making people feel certain about your confidence in doing that position and presenting yourself to them. So, but to stick to the slides, I've got to be careful not to veer off as well. So the panels are assessing, of course, patient safety, communication, and all of the other points listed here. I'm not going to read through every point in a PowerPoint presentation, but that's overall a good summary, I feel, and regardless of what level you're at, what career stage you're at, I've tried to make this pretty much across the board, but of course there's nuances for people trying to get onto training and people who have completed training and who are applying for consultant interviews. So this is a very really one-size-fits-all kind of presentation this evening, but I can certainly provide people with more nuanced advice regarding their career stage and the jobs that they're applying for. So that final note at the end, the best candidates make panels feel reassured. It's really that they've got peace of mind, that knowing that when they're not there or when other seniors aren't there, that you've got things in hand. And even if you are a senior clinician, that you take ownership of the patients that you're working with, and you're a strong member of the team and the multidisciplinary team, and you know how to navigate the challenges that come up, and they certainly come up for consultants just as well as they come up with for other people. But it's the way that you carry yourself through those challenges are the things that they're looking to assess. The biggest difference between the sort of average scoring candidates and people who score more highly is the average candidates tend to describe. So as I mentioned before, possibly going into too much detail. And I'm often reminding my clients, beware the long story. So when they start telling people about an experience, they'll go into providing a level of detail that's a bit too granular. So there's a few people I'm working with at the moment where I'm really trying to get their story across in 2 minutes rather than in 4 minutes. And that's quite a lot. That's a lot of time. So the way that you do that isn't so much by leaving information out, but learning how to summarize the key points and certainly staying away from over-explaining concepts to a panel who understands what the concepts are. And the rest there, and that's the focus on the tasks as well. So focusing on what they did rather than the reasons why they did it and what they took away from it, and how they worked with others to come up with the solutions. People are most interested in the process that you follow. How do you come up with solutions, especially when you're challenged? And do you take stock and step back and think and speak to the right people? And afterwards, when that issue's resolved, whether it's a difficult conversation with someone or an emergency clinical situation, that you afterwards go back and reflect, debrief with others, follow up potentially with some quality improvement and analysis of how things could be done better next time round. And that's where that systems thinking comes into it. And even also really being always aware that, it's not only you who is there to solve this problem. There is a system around you built to make sure that doctors and all healthcare staff can provide the care that is needed in a group situation rather than it being an isolated sort of position. So in contrast to that, the top tier candidates, as I've mentioned already, explain their reasoning for doing things, the why they did something, why something worked, what they've learned from it, what they took away. Did that change the practice for other people there? They're all really strong pieces of information to convey if they've been part of your experiences. They certainly communicate clearly. So you really have to make sure that you're speaking loudly enough, that you're making good eye contact with all the panel members. You're not looking away while you're concentrating. I see that quite a lot, or people looking down. You need to engage with the people that you're speaking to. And that's why practice becomes so important prior to an interview. To be speaking out loud, getting used to the sound of your own voice, and getting familiar with the concepts that you want to convey and the words you're going to use to convey those. And practice is the way to really hone in and identify how you can keep improving further. And sometimes it's small things. I was working with a consultant about 2 weeks ago, and he'd never done it before in any of our previous 3 or 4 meetings, but in the final one, he was tapping his foot, sort of bouncing his foot up and down. And I could see that because his whole self was moving as he was answering. And I said, "You've never fidgeted before. You need to drop the fidget because it's so distracting that is really going to detract from what you're sharing, the content you're sharing with the panel." So clear communication, speak up, make sure your internet connections are sound before you get online. I had a terrible line with someone this evening and we switched to the phone. So have your backup plans in place as well for actually getting the technology together if it's online. And certainly the top candidates prioritise safety. Often I hear doctors talking, they give all this great information, and the other day I had to remind someone, and what about the patient? So, just bring the patient into every question that you possibly can. And it really is most questions you can come back to patient safety. If that's your first priority, that's a great way to start a response. My first priority is patient safety. You wouldn't use it for every response, of course, but say it once. It's a strong statement. It's telling people what your key focus always is, because that's what the health system is designed to deliver, patient-centred care. So it's on all the position descriptions. It's everywhere. So you saying it in an interview is certainly not going to do you any harm. As I've said, reflect on your experiences and show what you've learned, show what you've observed in other people as well, what you've seen that works well. I often mention to clients, have a look at the way the consultant speaks. If the client is someone who's speaking really quickly, I pull them up and say, look around you when you're at work, listen to the way those more senior people are speaking. They're not in a rush. They're very considered, and they use their words deliberately and carefully in order to convey information in a very succinct and effective manner. And that's what you're aiming to achieve. And certainly demonstrating your professionalism and teamwork. And a lot of the questions, when I show you some tonight, I hope you'll sort of bear in mind some of these points, such as that one. You'll start to notice that what are they looking for here? It's professionalism and leadership and maturity, and they're the candidates who are going to score well, the ones who are able to achieve getting those points across. So, as I've mentioned, those answers reassure the panel that you're safe, thoughtful, you don't dive in, and you're ready for the responsibility that comes with that role. So moving on to structure, the heading, the title of tonight's webinar, as I've said before, it's very important. It helps you stay calm under pressure, answer very directly rather than leading in with a lot of content or words that don't really add any value to your response. And you'll see that with these structures, they start at the beginning, start here. And even if you get that first part of the structure off, you've started your response very strongly. Sometimes people will give me this opening statement that basically repeats back the question. And it's good to reflect the question back, but it's a bit of a waste of your first 10 seconds in that response to do that. I prefer to see people cutting to the point, especially when they've only got 2 minutes to respond to what is normally a fairly complex situation, a question about a complex situation. So get to the point, and certainly avoid rambling. Stay on track. Show that you do think in an organised manner, and that's what the structure gives you. And it enables you to cover the key domains consistently. And the key domains are essentially really the competencies that relate to that specialty. And for those of you who've been in my webinars before, and some of the recordings are on YouTube, you'll know that I'm always talking about that, about the importance of recognizing the competencies and what they're looking for. And you can see it in the interview questions and start to identify what is it they're looking for with this question. So we want the panel to flow and go along with your story, and that you can tell this, rather complex situation, explain that or concept in a, say, 2-minute time period, and you take them the full circle, starting it off, telling the story and coming back and closing strongly, and then be satisfied with the close. It's a full stop, no need to keep going. Move on to the next question. Okay, these core frameworks, and as I mentioned at the start, I'll provide you all, I'll email these either this evening or tomorrow morning, a 4-page document outlining these. So I really wanted to give people a bit of a leg up to say, when you get these types of questions that are listed there, think about this model. So I'm going to go through each of those and show some examples regarding what's a strong answer, or what's an average, what would an average answer entail related to those questions. So first, that's the framework. So the CAMP is motivation and commitment. So start with clinical, academic, management, and personal. And personal doesn't mean what you do outside of work, although you can touch on that. But it usually comes up somewhere else. It can come up in the sort of first question. Often the first question is one that will do well for you to answer with a CAMP model. And so, there's personal, professional aspects that they're most interested in, such as your values, why you're here, and what your strengths are. So if you can lay out some of your strengths in the first response of the interview, you're off to a good start. And really, there's no excuse for people to not have a pretty strong answer for that question, because that question is really often asked first of all. Why have you applied for this role, and what at this network, and what do you bring to our department? So there's kind of 2 or 3 questions there, so you have to make sure you cover off on all of them. And this will help you do it. But as I said before, often people fall into the trap. They'll hear the first half of the question and they'll forget about the second half. And I'm often prompting my clients to say, and what about the second half? What do you bring? Please don't forget to tell them what you bring to the role. Rule number 1 is really listen to and understand the question. And if you're not sure, you can ask them to repeat it. There's nothing wrong with that. Okay, so that's the first one, such as why are you interested in this specialty? You see there the average answer, and the better answer is going into more detail, more useful information to that panel that tells them more about you. Not a very generalized statement. You have to go into it deeper there. And of course, showing your understanding of the specialty, more so if you're coming into it, if you're applying for training, and if you're out the other side of fellowship, you certainly understand the specialty. So those sorts of, the question will obviously change and the content will change as you proceed. So be specific and show, your reflections that you have reflected along throughout your career, and what's led to you to this point really is that question, and why do you want to continue on that pathway? And that's why often always when I'm working with a client, even if we do a 1 hour session, I still want to know what people's goals are. And I mainly want them to have those front of mind for the interview. Because even if an interview panel doesn't ask you what your goals are, they will want to know. They're curious. So my recommendation is to have that in your CV as well, and then that you remind them of that in the interview, so that people can help you on the way to get there, and that they can see that you have thought it through, and you have a tendency to plan and set goals and work towards them, which is a great approach regardless of what career level you're at. Now, the SPIES framework, you're probably familiar with this one as well. Oh, sorry, I've got the wrong ones in there. So I'm going to read those out. There's a reason why I've got my handout next to me, but I mean, I know I've seen them so many times anyway. So SPIES is seek information, patient safety, taking initiative, escalating, and support. So they can be used for ethical scenarios, professional dilemmas, communication challenges, and safety questions. So I'll re-record this session because I'll have to correct that slide before I send the recording out to other people who weren't able to be here. So my apologies for that. So an example of that is a question that might be related to that is the wrong side surgery scenario that you're probably all familiar with. So I'll let you to work through those points. The main part of this is, that you're not afraid to speak up when it's such an important issue of patient safety, or potentially patient safety is at risk. So, that's a pretty self-evident one. However, I am aware of what the culture can be like within high-stress workplaces that you're working in, such as an operating theatre, and there is a hierarchy that exists, and it's your professional duty to recognise the hierarchy, but first and foremost protect the patient from any potential harm. So that's where you'd bring in a SPIES model. The STAR plus FL framework is great for behavioural questions. And this is where people can fall into a bit of a trap of the long response or the long story. So set out that situation very clearly. That's a sort of a tell us about a time you've done this situation. So give them the situation, the tasks that you identify you'd need to do, you and the team, the actions you took. So include other people in this, because as I said before, medicine's not an individual pursuit. It's a team pursuit with a shared goal. Tell them what the result was, and then really importantly, add your reflection. Did you receive any feedback from anyone about this? And what did you learn from it? And has it changed your practice? So that's quite a lot of ground to cover in a 2-minute response, but that's why the framework will help you. And even if you touch on those points, they're not deep answers. If you've got an hour-long interview and you're going for a VMO position or something, it's a different story. You've probably got then 7 or 8 questions, and you've got more time. You've got 4 minutes or more for your responses. But for most people, in most situations, it's 2 minutes a question. So that's why I'm running this session tonight. So in a question that might relate to that or require or where that structure will be helpful, would be describing a challenging clinical situation. So briefly set up the context of the situation, focus on your actions, say why you made certain decisions and who was involved in that process. Of course, reflecting on the lessons learned and explaining how it changed your practice. So I've already covered off on that last point. The details of the family members and all the complexity of the family that was there are probably not going to add much value to your response, except for there are always exceptions. One consultant yesterday, who's got his interview right now, was telling me about a setting he was working in where the family group turned out to be about 40 people and community. And so that was a totally different type of communication exercise in a very specific sort of setting. And that sort of level of detail would add a lot of weight, because not only because it's unusual and he can demonstrate that he's able to facilitate that type of communication. It's a skill that he's developed over many years, but also because it's relevant to the position that he's interviewing for. So, you always have to sort of temper things and decide which pieces of information are going to be the pieces that I want to bring into this conversation that isn't a conversation, it's an interview. But this setting that where you're telling these about these experiences that you're having. And I often say to people, the metrics can be really useful. How much did you improve patient results by if you conducted an audit or another quality improvement activity? How many people were you communicating with in that very, unusual example? It's the first time I've ever heard anyone bring that into an interview response. And I've been doing this for 11 years. So that really stood out to me, and thinking about what metrics or results are going to sort of cut through and have a lot of impact. For other people who've done a lot of research, often I'll ask them to include the amount of funding that they've been able to access via grants for research projects, because the numbers tell a story of their own. And it helps people understand the scale and the scope of your achievements. So the spikes framework can be used for the difficult conversations and breaking bad news. I'm pretty certain you would all be familiar with this one, so I'll leave that one to speak for itself. So, for example, withdrawing a treatment, that kind of discussion that you would have to have with patients and their family members. So there's some pointers on how you can strengthen your responses. And someone I've been working with lately is a palliative care consultant. And these are the types of themes that he certainly covered during our practice sessions. And yeah, I won't go off on a tangent about that now. That's been a very rich and informative engagement that I've had with him in terms of learning more about the way palliative care physicians work so closely with the patient's family as well as the patient, and understanding their circumstances now and what's to possibly come in the future, and how he tempers his role with respect to those. And essentially, of course, empathy and clarity are both really essential. So taking the time to speak to and listen to the people involved in those sorts of discussions. The clear framework is another one that comes in to play very helpfully when you've got a conflict resolution or a teamwork question. So clarifying any information that you might be unclear about, or that hasn't been conveyed appropriately, listening to the other stakeholders, showing empathy where it's needed, working out ideally a shared plan or a compromise of some nature, and taking the steps then to work through it and reviewing afterwards how that process went. And that often includes coming back and following up with that person or those people to check in and see how things are going. It's not a sort of fix it on that day and then never speak about it or think about it again. It's working out how can we continue to move forward in a stronger manner post conflict. So staying calm and professional. There's the professional point, one of them that I was alluding to earlier, and of course seeking to understand the other person's or people's perspective. And sometimes it might be a few people that you need to speak to. Don't forget about patient care. That's, I think, a situation where people could get very focused on the actual conflict and those individuals and start losing sight of the patients that everybody is there to care for. And so that's a great example of, come back to patient safety, and that can be used as one of your part of your conversation with your colleagues or whoever the conflict is with, to bring it back to patient care and away from individuals or individual personalities or whatever's going on. Blame is definitely a below the line behaviour that you want to avoid at all times. It's not professional, so don't be careful about the examples you choose if you're worried that you might sound like you're blaming somebody for something that happened, or if you can't sort of find the right words to navigate your way out of that and into an appropriate response. And of course, escalating if things remain unresolved, because at the centre of this is the bigger issue of workplace culture. And that's something else I've been talking with a lot of clients about lately, because the whole culture of a department or a room, an operating theatre or a clinic can be altered by the presence of one or two people, and they can affect everybody else's approach to work and effectiveness. That is the reality of the situation. So, everybody in a team ideally should be working together to build a strong culture where people trust each other. They feel that they can communicate effectively with each other, and they need to address any challenges that come up to support people who are perhaps challenged by effective communication or something else, in order to develop a better team environment for the sake of the patients. At the end of the day, it always comes back to them. So a note there about the examiners looking for emotional maturity, how you resolve these difficult situations. Okay, so here are a few scenarios that get put together on a regular basis for interviews, again at all levels. Informed consent is a big one. Unsafe colleagues, and the list is there for you to see. So that's a good starting point for even thinking about how would I respond to questions of that nature. And do I have examples that I can use that and would enable me to demonstrate the way that I dealt with those types of situations? And that's another resource that I'm working on at the moment, is Actually, I've shared it with a few of my clients recently. It's building strong examples, and ideally building examples that you can then adapt to different situations. So it might be the same story, the same clinical scenario that you can tailor to address the competencies that the panel is asking about in that question, or shape it to address a different question with different competencies, but by using the same example. So, for example, the scenario might be a deteriorating patient and how you managed in this emergency situation, and then looking for your medical expertise, your communication skills, your work with the multidisciplinary team, for example. And then for another question might be about a leadership question when you've displayed leadership. And I'm just letting someone back in. And so that example might be able to be used to show the way that you took control of the situation and organised the team and set out a plan together and delegated tasks, and whatever else you've experienced. So you can sort of flex examples rather than trying to come up with 100 examples of 100 possible topics that could come up in interviews. And on that, I don't say that to get you really worried. I would say there's really five or six key themes that are often covered in these interviews, and often there's 5 or 6 questions, and they are your background and motivation for being there, what you bring. So that could come in a whole lot of, could be posed in a different ways in questions that are still looking for the same thing, which is where you really advocate for yourself and promote your strengths. And conflict is so common, and communication and teamwork, a question exploring those. And often there's a clinical question as well. So that's 5. And you're only going to get 6 probably, except if it's an MMI, which of course is a STEM question with follow-up questions which are delving deeper into that scenario. But still, I mean, I really notice that there is very much a common theme that covers those areas, that I think hopefully will help you recognise that there are those sort of types of questions that are going to be asked. So it's very doable to prepare for those. And I enjoy hearing from my clients when they come out of the interview and say, oh, there was nothing that we hadn't covered in that interview. And that's what I think is really possible to do with some preparation and practice to cover off on the key topics that are going to come up. And of course, there are some red herrings from time to time. And, one of the things that I think is going to come up a lot, particularly with entering into specialty training at the moment, is AI. I believe it was asked in a few specialty college interviews last year, and I'm sure it will be appearing again this year. So really think about the use of technology, and the challenges that it brings as well as potential opportunities. So with an unsafe colleague, that's another potential question, another difficult situation, but again, that where patient safety comes first. So once again, you bring patient safety into it, and you manage it carefully, with that emotional maturity that I referred to a moment ago. So think about how you'd respond to those types of questions as well. Post-operative bleeding is another one. I can't even remember where I've drawn this one from. But, again, the strong structure is going to help you work through that clinical scenario. You've got 2 minutes. Imagine you have 2 minutes to answer this question. And the structured A to E assessment is always a great point to mention and essentially it's an essential point to mention in those deteriorating patient or high acuity clinical scenario questions, and getting onto everything very quickly, and using the people around you, bringing other people on board to help again. Okay, another example, going against a consultant's decision. This came up with one of my clients recently. So really focus on that, clarifying the understanding before you go hurtling into taking something on that you've perhaps misconstrued or misunderstood, and respectful professional communication in the right setting, appropriate to that person. You're unlikely to challenge a consultant's decision in front of a group of people, but there could be times when you may need to do that in order to preserve patient safety, and certainly escalating and taking it further if it doesn't get sorted out. I'm sure you've all thought about that kind of question, and it's always worth, though, reviewing that, because that's really a test of your confidence and how you're going to, whether you're able to stand up and speak up when something's not right, or when you perceive something as not being quite right. So here are some great, I think, introductory phrases to start off a response with, or indeed throughout a response. It's getting straight to the point. This is what I would do, or this is what I did. I reflected on the experience, or this is what I do all the time. So my approach is this. Letting people know this is how I work. What can they expect of you when they're not there, or they're working on the same shift as you? They know your approach. They know the way that you're going to handle things. That's what they're looking to find out in this interview. Okay, so calm, structured language creates confidence, which is so true. And I've got a download on the homepage of the website about sort of some words and phrases to help you elevate your interview language, and also speak more succinctly to get your message across in a shorter period of time. I've potentially rambled at times this evening, so thanks for bearing with me and staying the distance. In interviews, rambling certainly does cost marks. You don't want to lose your audience. If people start looking around or looking a bit away and you can feel the lack of engagement, you've got to check yourself and think, come back to this and close off the point and close off the response at the right time. Make sure you do all of these other things. I know I'm mindful of the time now. And again, there's that professionalism. Don't speak negatively about colleagues. You're all there to work together, and your reputation is forming and developing all the time. And careless words can really undo people very quickly. And it's hard to build people's trust back after negative behaviour like that. So really think about that. And especially in an interview, don't speak negatively about colleagues. So practice out loud, record yourself, use these frameworks. Please get used to timing yourself. Get a feel for what 2 minutes feels like, what 15 minutes feels like. After 10 minutes, the interviews, most of them are done and dusted in 10 minutes, or, might be an hour for MMIs or a few hours, but, be aware of what the time frame is for the interview. That's one of the first questions I always ask my clients, how long they've got, because that determines how long their responses can afford to be. And then the rest of those points there. You don't need to sound perfect. There's no such thing as a perfect interview response or performance. You don't need to perform. You need to show that your professional self, that you've put some effort into preparing and practicing for this important meeting, and you've got some information that's going to help them make a great decision. And, impress upon the panel those points that you're safe, you're thoughtful or considered, professional, reflective, collaborative, and calm under pressure. All of the things that doctors are expected to be, that's what they're assessing, what's important for people to practice well. And that last line, I think, is a great place to end it. I think it ends shortly after this slide. It comes down to trust. Everybody wants to know that the people on the team are someone that they can trust to do a great job, to ask when they're not sure, and to have their backs and be there to support them in the best and work in the best interests of the patients. It's very much a trust exercise. So thank you very much for joining tonight. I'll stop the recording now, and if anyone has any questions, feel free to stay behind. And otherwise, I hope to see you next Thursday and the Thursday after for the next 2 webinars, which will be on different interview-related topics. So thank you.